Hi guys, welcome to another fine edition of Detox Directive with Dave. Actually, this is not another fine edition. This is the debut edition, actually. So, I am a retired nurse now, and I have worked for the last 27 years in a medical detox unit. And in that time, I have taken care of hundreds of thousands of patients detoxing off numerous substances. So that process primarily involves medicating patients under the doctor's orders through their withdrawal symptoms, which usually runs anything from 3 days duration up to 7 or 8 days duration, depending on what it is that they're coming off of. In that time, I worked under medical doctors, physician assistants, nurse practitioners were directing the care. I'm retired now, like I said, so I'm not here to give medical advice. I'm not here as a nurse. I'm here to offer a layman's perspective. I have my own history of addiction, so I have that perspective as well, and an extensive voice of experience. So my hope and my prayer is that this will benefit someone in need who's dealing with this problem. Over time, I want to make several different videos regarding typically abused substances that people in particular will require medical detox process to come off of. So there'll be more videos coming over a period of time, or modules, if you want to call them that. First and foremost, these days, probably the most important thing in regards to what people are coming off of medical detox wise would be the fentanyl crisis. I recently was reading where over 200 people per day are dying through overdose of fentanyl. Over, I think it's 73,000 lives per year, which is nothing short of tragic. These are not old people that have lived their life and are dying at the end of age. These are typically 20-something, 30-something, and 40-something-year-old men and women who still have the bulk of their life in front of them. So it's a tragic loss. I want people to know, in particularly, if you are struggling in the middle of a fentanyl habit, fentanyl addiction, I want you to know that you can get off of fentanyl. It is possible. It is doable. It is difficult, but it is doable. Most people that are on it require a medical detox process to come off of it. So that being said, I would say if you're using any more than 1 or 2 days per week out of the last 7 days, you're going to need a medical detox process. Why? Because the withdrawal symptoms coming off of fentanyl are so bad. They are so horrific. That's what keeps people returning to the drug, just to keep from being physically miserable. The suffrage is tremendous. So don't kid yourself that you can do this on your own, because you can't. And it's a doable process with medication and guidance and of a medical team, doctors and nurses, to guide you through your process and help you through your process. So I want you to know first and foremost that it is doable and you can do this, but you're going to need help to do it. Physical withdrawals are typically the sweats, stomach cramps, diarrhea, anxiety, vital signs raise up, blood pressure elevates, typically pulse rate elevates. Many people coming off this stuff feel like they're going to die, literally. That's how bad the withdrawals are. They feel like they're going to die. You won't die, but you will think you're going to die. But the medications that are used help a lot. They help tremendously. Typically, the unit I worked in, there was basically 3 formats for people coming off fentanyl to choose as far as medications to help with the withdrawal processes. Time frames as far as how long you would be in a unit, in a medical unit detoxing. Typically, for most people, you're looking at 3 to 4 days time frame. For heavy users, you're looking more like probably typically 5, 6, maybe 7 days in inpatient, in-house, while you're on medications. And when I say heavy users, we're talking about people who could be long-term users that have been using it for years, multiple years. Or you could be heavy user in the sense of 1 gram a day, every day, 2 grams a day. I've seen people using up to 3 grams per day, every day. So those people are definitely going to be 6, 7 days just to get stabilized and comfortable enough to where they can be discharged out of the detox unit and then go to rehab or go home, whatever the case may be. In the unit I worked at, the typical 3 options were to use non-narcotic medications to help with the withdrawals, typically for 3 or 4 days time frame, which typically would be medications like baclofen or clonidine in combination. So take those for 3 or 4 days and then done and finish with withdrawals and ready for discharge. Or buprenorphine or Suboxone. One option is they could be on buprenorphine for 3 days time frame to help with the withdrawal symptoms and then done. and ready for discharge or ready for transfer to a residential format. Another option is to get on buprenorphine, which eventually transitions to Suboxone for a long term, which could be 3 months, 6 months, 9 months, a year. Some people are on Suboxone for multiple years. Typically, the unit I worked in would only put people on Suboxone long term in conjunction with rehab. If the patient was willing to do rehab, whether it's outpatient or inpatient residential, they could be put on it long term for months in conjunction with rehab. I don't really think it's a good idea. There are doctors that'll put you on Suboxone on an outpatient basis with no rehab included. They won't mandate any type of rehab. I don't really think that's a good idea. I think if you're going to be on Suboxone long term, then you should be followed by a physician that's prescribing it, and he's monitoring your rehab process as well. That's how it was done at the unit that I worked at. But there are a lot of physicians who are authorized to prescribe Suboxone and will do it with no rehab at all. So that is an option, but I don't think that's a good idea. And the facility I worked at, nor the doctors at that facility, felt that it was a good idea either. So that's kind of a basic format on fentanyl detox, to give you an idea. There is a thing called precipitated withdrawals, which is real and is significant and occurs for some fentanyl users. I'm not going to get into that now. Maybe I'll make another video on that later to go into that in more detail. If you need to find out where you can go, if you don't have insurance to go to a detox, I would suggest you call whatever hospital emergency room that you would go to in the event of an emergency. Call the ER of that hospital and ask the staff there where you can go for detox purposes if you don't have insurance, because that's who will know where your options are if you don't have insurance. I know the facility that I worked for here in Jacksonville, Florida, would treat patients on a sliding scale based on their income, even if they didn't have insurance. I don't want to mention the name because I'm not a representative of them anymore. I don't work there anymore. And I haven't been authorized to give that name out. So out of respect, I'm not going to do that. But I do know that if you check with the ER of your local hospital, they will know who is within your area that they can offer treatment as far as the detox goes. I guess that's going to be it for now. God bless, and I hope this helps. Thank you.